Come on, if I turn this on. Okay, yeah, that's a lot.
Hi, and welcome to Khan Clinics. We're here with another episode. Khan Clinics, as you know, powered by American Muslim Today. Today we have a very fantastic topic and a brilliant guest as well. We're going to be talking about chest pain and what's its implications and why is it important that we all identify it. Which chest pain is relevant, related to cardiac, and which is not. And that's very important. Our guest today is Dr. Maha Iftikhar. Dr. Maha is a graduate from ANMC, and she currently works at Pulmonx Plus and also works sometime at she works as a medical officer in the interventional radiology. So, Dr. Maha, how are you?
Alaikum, sir. Alhamdulillah, I'm fine.
Okay, so very good. Welcome aboard.
Thank you.
Before we start, we're going to play a couple of little videos just to get ourselves introduced to the topic and stuff. So, Jeremy, why don't you go ahead and play our intro videos, please?
Yeah.
Let's do that.
Oh, I don't think I could do that.
You okay, Jeff?
No, I don't think I am.
No?
Oh,
Alright. Right, Jeff, I'm going to need you to get down on the floor for me, please.
It's hurting.
Alright, just lower yourself down. Right, Jeff, I'm going to get some help, okay? Right, Jeff, I've got you an aspirin. I'm going to need you to bring your knees up. It's going to help support you. I've got an aspirin.
I feel like I'm dying.
I need you to pop this one in your mouth for me, please. Open up your hand. Pop it in your mouth and give it a good chew and then put it under your tongue. Ambulance is on its way.
Oh yeah, I feel like I'm dying.
Just deep breaths. That's it, well done.
If you suspect a heart attack, be sure to look for the 4 Ps. Pain in the chest, pale skin, a pulse that's weak and rapid, and perspiration. You need to act quickly. First, sit the casualty on the floor with their head and shoulders supported. Call 999 or 112 and ask for an ambulance. If you're in a care home environment, only administer aspirin if you're authorised to do so. Keep checking breathing, pulse and responsiveness. If the patient loses responsiveness, open the airway and prepare to give CPR if breathing stops.
So that's sort of like a little bit of an intro to our topic, and a lot of you may not have seen people with chest pain collapsing like that or going through that sort of phenomena. But I think today's topic is all about identifying those patients and discussing a little bit about them. And then if you are there in that situation, what are the things you should look for? Who should you call and what you should do? So that's all relevant in our discussion today. So I'm going to hand, we've got another video to play after this. So Jeremy, why don't you play a little bit of our second video and then we'll get Dr. Maha involved in the discussion.
Their chest in pain. But did you know chest pain is just one of many signs? Heart attack symptoms can vary from person to person, and knowing what they look or feel like could be life-saving. Some signs of heart attack are a little more obvious. But there are other subtler symptoms. Women often experience these seemingly quieter symptoms. Familiarizing yourself with all the symptoms of a heart attack is important, so you can spot them right away and seek help at the first warning sign. If you or someone you know might be having a heart attack, always call 911. Life-saving care often begins right inside the ambulance. Dispatch will also alert your nearest Munson Healthcare Hospital, where our award-winning heart team will be waiting. To learn more about Munson Healthcare's nationally recognized heart services, visit munsonhealthcare.org/heart.
I think that sort of sums up what we should be sort of be doing it. That's in some situations. But why don't we hand over the mic to Dr. Maha? And Maha, would you like to tell our audience a little bit about the chest pain phenomena and walk us through what is relevant and what are the things that we should look for?
Okay, sir. Good afternoon, everyone. Today I'm here to present you about the chest pain and heart disease. But the main topic of discussion is which heart pain you can watch or which heart pain is an emergency. Okay, and I will also go over to the ischemic cardiac pain, non-ischemic chest pain, and their signs and symptoms. So, what is chest pain? A general term of any dull, aching pain in the thorax. It can be related to cardiac issues and non-cardiac issues. So, if you see a person having tightness or poorly localized and it's associated with physical exertion or other stress, and it's relieved within a minute or with a rest, and it's usually you can say that it may be a sign of cardiac disease or cardiac related issues like MI. Or if you see a person having sharp and stabbing pain and which is well localized and maybe positional and spontaneous at rest, it is usually related to the lung disease.
Okay.
Okay, there are many.
So
Okay.
can we just go back? I have a quick little question here. You're saying if we're feeling pressure or we're feeling tightness, that's a little bit more concerning. Pressure on the chest is something that we see a lot in clinical practice. They're feeling pressure all the time, and they're feeling, they may feel tightness. And
Yes.
and from that, we're gonna say the intro video said the 4 P's that you need to identify. One is that are they sweating? So if someone is saying I've got pressure, I'm feeling it right in the middle, that's you're saying it may be poorly localized, but sometimes it is localized. It's right behind the chest. If they start additionally sweating with that, you gotta pay immediate attention. Even if you're across the room and you're seeing someone holding his breath, but you see that he's perspiring. Perspiration is another term. Sweating is a term that we use here in the US. So those two things combined is sort of like a big red flag for you. So the take home message, you see someone in discomfort, you're seeing chest pain, you're seeing that they're holding their hand at the chest, which is like Dr. Maha saying, and they're complaining. A lot of times they would do this. They're saying tightness because they're feeling the pain. Just remember, I want to say this so we all understand. How severe do you think chest pain is when it's cardiac? When it's heart, heart is just like this big size, right? It's not a big organ, and normally you don't even feel it pumping, right, Maha? Or Maya?
Yes, sir.
Maha and Maya. We got two Maya M's today. So I'm just gonna say to Maya. Hearts could be and some people have a very little heart. They may be little because the stature may. So how severe do you think the chest pain is gonna be? Let me give a few numbers. 4 out of 10, 7 out of 10, 10 being the severest, or 10 out of 10. It's a question out. So today we have Maya and we also have Rida. So I'm going to get 2 views from 2 different women today. I know Maha would know, but I want to say in general terms, what do you think? And we're going to get numbers from everyone else. No one said anything. And I know in the audience there are some very smart people there. But let's get Rida and Maya's opinion on this.
Yeah, it would have to be pretty severe.
Mm-hmm.
Hurt pretty bad. Can't breathe. Sweating.
So you say what? 6, 7, 5, 4, 3?
Highest, yeah.
Highest. Rida, what do you think? Hi, Rida. What do you think?
So can you hear me?
Yes, we can hear you, Rida. So tell us now. What do you think?
So I think sweating should it takes precedence over that. I think it's a good indication of it.
Yeah. Do you know why they are sweating? Why do they sweat? Why are they sweating?
So
So why do they start
I
sweating
think
if they're having this chest pain and I say, oh, he started, you know why they sweat? Because the sympathetic system gets activated and because they are in so much pain, sometimes they can't even move their arm, they can't say anything, they can't even pick up their phone and say, call 911. That bad. So true MI can be so, and they sweat because the pain is intolerable. So the more the pain, the more the heart demand gets worse, and it makes all of this worse. So that's why one of the few times when you go to the hospital, they give you which medication first? Think about it. They give you pain medication. Do you know which one they give?
No.
Rida? Do you know what they give?
blood thinners.
No, before blood thinners, for pain. They gotta give a pain medication. Yes, they're gonna give some, let me say this. They are gonna give you Plavix, the aspirin, nitro to relieve the pain.
I was gonna guess.
No, to relieve the symptoms. But for pain, what do they give for pain?
Is it aspirin or no?
No, it's not
Okay.
aspirin. They're not giving aspirin for pain. So they're gonna give morphine for you. One of the medication that has the severest of effects on you. Yes, they give opioids, as someone has said. Opioid, which opioid they give? Well, it's not a light opioid. It's gonna be something very severe, so your pain can dissipate immediately, because the more you're in pain, they want the pain to go down to, like, what do you think they want their pain to go down to? Anyone? Let's just say everyone's saying, okay, you got a 10 by 10 pain, your pain when you get in. But what do you say it goes down to now? Do you want to at least cut it in half? Do you want to cut it in 1/3? What's the target here?
Yeah, I would say cut it in half if you're already at 10-10.
Yeah, Rida, what do you think? Maya is
Wouldn't the
saying,
morphine just put him really, really back to sleep or something like that?
yeah, that's a good
We wouldn't want
question.
them completely fainting.
Actually, that's a good point. Morphine is not a sedative, contrary to what we think. Morphine does not put you to sleep. It relaxes you because it can act on certain receptors and do that, but its purpose is not to put you to sleep. And you know what the pain level do you want? The nurses will keep on coming and asking you. You want it down to what I've got, some saying half, some saying 4 by 10, some saying 3 by 10. Rida said, put you to sleep. I like that. That's actually better, because you're only going to sleep if your pain is gone away. Maya said half. Jeremy said, well, guess. I want to guess number. Everyone's guessing. I've got 5 people guessing so far. But I want to hear more than half. You want the pain to be Patuk. Nishta. 0. You cannot have pain when you're having a chest, when you're having a heart, even a heart related symptom or a heart attack. That's why this pressure, tightness, and the nurse will keep on coming and she will keep on asking you, are you in pain? It's her obligation. So that's the other take home message for you guys. An intense pain that's offshooting a lot of starting cascades around. And then when you are in the emergency, you make sure if he's in pain, you got to get rid of the pain somehow. And I said, that's one of the times where you are allowed to give one of the most. Morphine is addictive. Morphine's got not even available, in the market or anything. You can't get morphine, Maya, if you go and get it, unless you get it off the street or somewhere. Unless you say I'm someone who's going to relieve heart pain, and I'm going to inject it in, then you can get it. But it's available in the ED, and it can be or something similar medication. And like I said, I think the purpose is you can't be in pain. While you're there, they're going to relieve, give you other medications, and depending on the findings, they're going to adjust. They're going to go after the root cause of it, but the pain level has to be 0. So I like it that you all guys put your comments in, but now you're going to say, well, if you are in pain and you're looking at mild pain, sometimes we have angina. So don't get me confused with angina. If you're having a heart attack, your pain has to be 0. Now, angina is a little bit different. Angina, we call it different terms. So people say it differently. That's not a full heart attack. So there's 2 terms that we're going to use. One is Dr. Maha was already saying, infarction. MI is an infarction. Infarction is death of a cell. Infarction is a death of a cell. Ischemia, it is when the blood flow is low. It's not dead yet. Okay, when the oxygen is low, that's the issue with it. The oxygen is low. That's ischemia. So not death. So there's a distinction. All right, Dr. Maha?
Yes, sir.
Okay, so she's saying if it's heart, we're gonna try to. There's intense pain. We're gonna bring it down to 0. And what if it's not heart pain? Now what do you do? It's not heart pain. Do we need to bring the non-cardiac pain immediately down to 0? Because you don't want to start shooting morphine every single time, right? You go in and say, oh, I need a little bit of morphine. Gonna put someone to sleep. I got chest pain. And that has happened. There are some habitual seekers. They actually know what to say, how to act, what to get their dose. So, but now we've become smart as well, right? Because we look for other things in them. Okay. All right. So the other pains you don't need to bring back to 0 is the point. Okay. And one of the interesting things that the non-cardiac, she's saying, remember this on a slide, that it can be focal. It has a trigger point. A lot of times, if it's not substernal, if it's on the right side, let's say it's on the right side, and you ask them to, then you touch it. So I'll go and touch it. And if she does a jump, or if I'm able to demonstrate or elicit the pain, then I know that that's not heart pain. Now, I don't want you to become doctors, but it's one of the signs that we do, that we will go and touch. We go and touch that chest pain. So if someone in front of you is having chest pain, and sometimes they start becoming so anxious that they can't breathe. And when they know they can't breathe, they start sweating as well. Because, oh my God, it's my heart. But if you go and she say, oh, it's right here. And if you go and touch, and she jumps in, you got to say, dude, this is probably not heart pain. You're becoming very anxious. And you're working yourself up. And that happens too. Okay? So the pain feature is a little bit different. It's like a sharp pain. It's focal, meaning it's got a touch point. And it may be when you move, it gets worse when you move. And if it's like, oh, I'm moving in this position and it's worse, but I'm doing this and it's not worse, so that's a little sign as well. So that's very, very, yes, this is someone saying it's tender. It's a tender spot. And that's very important. Excellent. So this is very important for all of us to know. Because even though they say, oh, they're pale, pee, oh, what happens? So what happened if the same patient was in front, the person was in front, and this is going to be a question for everyone. The same person is in front, was complaining of chest pain, and all of a sudden the patient collapsed down in front of you. Let's say you're going on a high street, you see someone, and the patient right in front was saying, the pain, I've got chest pain, just the one that we saw, and I can't breathe. And the next thing you know, he's unconscious. What is your next step? I know there is a lot of things you can do, but I want you to tell me the first number one step you would do. What is the number one thing you should do?
Are you okay? Are you okay?
Okay, so Maya saying you're going to go and ask him,
Are you okay?
are you
the
okay?
person
But
down.
what if he's already unconscious? He's like, no, I'm unconscious, Maya.
Then you start CPR. No?
So Maya is saying you should start CPR. That's option number one. What is the other option? Okay, option number two, I get here, Rida, is call for emergency. Okay, option number two is call for emergency. Option number three, someone said, is make sure the airway is open. Airway is open. And option number four is someone also said, which is very good, check the pulse. Check the pulse. The fifth person said, well, touch the person. Make sure the patient is unconscious. He's not faking it. But I think but let's say there is really, really gone. You've got four choices. One of you, before you start CPR, someone said, do it. No CPR. Let's not do a CPR. Let's check the pulse first. Second person said, no. You're not going to check the pulse. He's already unconscious. Why are you checking the pulse for? Start CPR. And then the third person said, well, I don't want any of that. I want you to make sure the airway is open, so it's breathing. Got a different situation now. Someone said go and listen as well. That's an option. But let's say, of all the options we said 911, open, pulse. Which one should you do first? I want you to just think for a second. And then, Rida, which one are you going to do?
So don't panic and call 911.
Okay. Maya?
What's my option? Number one option?
Uh-huh.
Yeah, the are you okay? Are you okay is like the first step in CPR. So you say, are you okay, to make sure that like they are passed out and to kind of do all of that and check the airways. So I feel like you're kind of doing a lot in your first
So
step.
a lot of things happen when that is going on.
Yeah.
And I'm going to answer this question because this actually comes in exams. You immediately call first for help. That's what the video was about. Don't start anything. Don't waste your time. Don't start to. It's okay. Yes, we need to go and check the pulse. I'm not saying you don't. And yes, you have to probably check the airway. It's a good idea. Yes, when you do CPR, the new CPR guidelines are more like start chest compressions. Don't worry about the airway if you're on your own. Okay. But if you're two, get help, get someone with you, and call for emergency. And even though it's a little thing, when there's chaos and your loved one is down, you actually forget.
Yeah.
You forget the steps. You don't know what you want to do. And then, yes, ABCD, which means airway, breathing, circulation, blah. Position the patient. I agree with that. Go to emergency. Call emergency. First of all, get help. Simple second point I want you to remember of today's discussion. One, we said we recognize if the cardiac pain, and Dr. Khan and Dr. Maha said, well, God Almighty, it's going to be very severe, 10 over 10. Sometimes you can't breathe. It's catastrophic. And we've got to bring it down. That's point number one. And then point number two today is you call for help. Please, that's your take-home message for today. Calling for help. And the point number one, like we said, the pain that is very intense. All right, 10 by 10 pain. All right. Yeah, does that make sense? Okay, let's go on to check now the next thing, what Dr. Maha is going to present to us, because that was a nice curveball, right?
So, okay, there are many causes like issues in your heart, lungs, and digestive system. Some causes are life-threatening and some aren't.
Very nice. So let's go back. So you're saying the chest, the pain, intense pain in the chest could be it could be ACS, which is called acute coronary syndrome, which means a heart attack or an angina, right? Heart attack. But there are
Yes.
other causes of you having chest pain, and it can involve the heart, and it may not be a heart attack, but of all the causes she's 4, 5, 6, 7 put down, the one that we need to worry about, and the one can kill you immediately, is the coronary syndrome, acute coronary syndrome, i.e. the angina, esophagospasm, or sometimes, and the other pains that can happen, like the heart attack. Okay, so that's sort of like the top listed one, and this is for all of us, it's very important to understand. All right, let's have a look at next slide. Very good, very good. And one of the things that comes up sometimes is people get confused, is that patient starts burping sometimes, and they immediately say, oh, I had food just 2 minutes ago or 3 minutes ago. And they relate the pain in the chest a lot of times to indigestion. A common scenario that we see that causes delay in you seeking help, and actually even death, because they will keep on telling, no, it's from indigestion. Oh, I ate mango ice cream. Oh, I ate biryani last night. It's the biryani. Jeremy made that biryani and it was too spicy. And right, Rida, do you cook?
Yes, sir. This
You
exact
cook?
scenario happened to me.
Pardon?
My father, he had this attack a month ago actually.
What
and
did
he
you
said,
eat?
oh, it's just indigestion.
What did you eat that
Well,
time? Huh?
Pakoras. It was Ramadan, so pakoras and
Oh,
everything.
the famous pakoras did that. Oh, I see. So they caused what are the other diets that can cause it? Which other diets can cause that? Besides pakora,
think
why did
spices.
pakora cause indigestion? Because you had, right? We had,
Oil, I think.
yeah, the oil and the stuff, and sometimes we have indigestion but you didn't think you had a heart attack, right? It wasn't, or was it that bad that you thought, no, it could be a heart attack?
It was. He had those shooting symptoms. He had pain in his left arm, and then he was sweating profusely. But he till now, he's just convinced it was indigestion.
He is who?
My father.
Oh, your dad had it. Okay, so he had and he never went to get some help or anything like that?
He did, and he went through all of those separate symptoms and everything, and the doctor talked him to it.
Yeah.
Like, this is what happened to you, but he was like, no, it didn't. I know it was indigestion, and these are the symptoms. Look at me. I'm fit as a fiddle right now. I guess that's
So
the old generation.
okay. So that's that. Have you had ever chest pain, Maya?
No, but I don't know if you remember when we discussed high blood pressure, I said that my dad had a heart attack and he had to have a triple bypass. Like they had to go in, open his chest, and do surgery to remove the clogged stuff.
So did he have a heart attack right in front of you? Was he home?
No, actually. So I wasn't even home when it happened. I was at a friend's house. It was like overnight, and he woke my mom up and said I need to go to the hospital.
Because he was having pain.
Yeah.
So and mom didn't say, "Oh, it's indigestion. Go back to sleep again, honey." Mom said, "No, we got to take you. We got to take you to hospital," because she thought that something's not right. Because he was looking. This not dad would not do that. Okay, and that makes sense as well. I see. And it's very brilliant point. A few of the people bringing this up. Spicy food is very hot back home. People love it hot, and they put extra. What do you put extra? Like masalas or extra the red chilies on it and make it. But I also see some of people saying that caffeine can do that, and which is absolutely right. And processed food is if there is one diet that I want you to stay away from, it, and one of the ones that is got the worst reviews ever is any processed food. Do not stay away from processed food. Please, please, please. If you come and say, oh, I'm drinking soda, I'll probably tolerate that. Even Dr. Pepper, if you come to say it's not a good drink, I don't like it. It causes a lot of problems. Even if you say Dr. Pepper, Dr. Khan I'm taking that. It's a doctor drink. And I love it. It's very tasty, yummy. And Jeremy likes it too. I'm okay. I'll tolerate that. But it's the one that is the one that I say you're killing yourself. You're causing cancers. You're destroying your gut. Is any processed food. So please, please stay. That's probably the mini third take-home message. Okay, the processed food, and when we think that it's a fast food or it's a good food, it's not a food. It's a fast kill route. Okay, all right. So that's that on the esophageal issues, because a lot of people have GERD comes up a lot in the discussion, and even in clinical practice comes up a lot. Okay, Dr. Maha, brilliant. Let's go to the next cause.
So the next is the type of the chest pain. As Dr. Khan already told you that when a patient feels pressure or tightness or heaviness on the chest or burning sensation in the chest, it's related to angina, unstable angina, and acute MI. So if there is tearing occur in the inner layer of your body main arteries, then it will be related to aortic dissections. Usually the patient with aortic dissection feels sudden severe pain, loss of consciousness, shortness of breath, sometimes shock-like syndromes like vision problems, difficult in speaking, and paralysis. And when the patient feels chest pain, particularly pain in the lower chest, and it's triggered by meals, and there is a feeling of burning sensations which are related to esophageal refluxes and the peptic ulcer disease. And if you see a patient with pleuritic chest pain, it will be related to pneumonia and pleuritis. And according to this slide, if the patient feels musculoskeletal related disease, there will be a pain in the musculoskeletal system which can ranges from dull, achy to the sharp and intense pain that can worsen with certain movements.
Very good. Okay, that makes sense.
Yes.
Cool. So basically, it's saying that if burning pain when you're having heartburns or stuff like that, that's the one that gets it a little bit confusing. But remember, sometimes burning pain can be cardiac pain, and that's what Dr. Maha is saying. So I think that's a good point. Okay, let's have a look at next.
So the most important risk factors are the diabetes, smoking, hyperlipidemia, high blood pressure, family history of the heart disease, age more than 40 years, cocaine users, and the sweating.
Okay, I think the top four are very, very important, and everyone sort of knows that. Controlling your sugars is very, very important. And I have a lot of times, yes, everyone knows smoking is not good, high blood pressure is not good, and we discussed a little bit of high blood pressure last time. But the ones that get missed out a lot of times that are very controllable and get sort of slowly creep in is your diabetes. And people get confused a lot of time. Why do I get sugar? Why did I get sugar? I don't eat a lot of sweets and stuff, but you can still get sugar. And a couple of things is that really matter is that, let me try to explain something. I want to explain a little point. If I get up in the morning, okay, Rida, and I drink orange juice, lots of orange juice. Let's say I drink a big glass of orange juice. I'm taking sugar. That's sugar. Even if it's fresh orange, a lot of the fruits have what sugar in it. Sugar is carbohydrates, and carbohydrates is what causes diabetes. So a lot of the newest literature that's coming out now, it talks about when you raise your sugar up, your insulin is going to go up as well to curb all the sugar, bring all the sugar down. And that's when it starts becoming a problem. Spikes of insulin are not good. Steady low levels of insulin are okay. So if you take anything in moderate amount, whether it's whatever it is, in small amounts throughout the day, is better than taking a big chunk of it at once. So I just want to bring that out because, carbs, and they say, oh, I only do this, and you can't drink sugary drinks. It's like Cokes and stuff. They have a lot of sugar in them. In fact, a can of sugar, if you go and look how much sugar it has, you'll be surprised. And so is some of the other drinks that have a lot of caffeine in them, are very addictive. So they have sugar and they are addictive. So the addiction drags it in, and then you get troubled by that. But I see a lot of the other things that we have problems is we are not able to control our lipid level. Our cholesterol is a continuous issue. And that's why we decided we're going to have a separate talk about diet and what's a balanced good diet, what's a good. So we're going to be doing that in the next series. So thank you for bringing that up, Dr. Maha. That's very important. Let's have a look at next slide.
So the characteristics of the chest pain, whenever you see a patient feeling like squeezing, tightness, pressure, or burning sensation on the chest, or heartburn, or fullness in the chest, and the patient feels discomfort or severe pain. These are all the features of the characteristics of chest pain.
Very good. Okay. Next.
And the most important is the relevant past and the family history. If the patient have diabetes, smoking, hypertension, ischemic heart disease, and obesity, this means that your chances of developing the same condition may be higher than the normal.
Very good. Okay.
So now I'm going to tell you about how you will diagnose your chest pain or how your doctor will diagnose the chest pain. Actually, the chest pain doesn't always the sign of a heart attack, but that what your healthcare provider in the emergency room usually tests for the first because it's potentially the most immediate threat to your life. They also be checked for the life-threatening lung conditions such as collapsed lung or a blood clot in the lung.
Mm-hmm.
So the most immediate tests including are the blood tests, your heart proteins can be checked, the CT scans. CT scan can be spot a blood clot in the lungs or find an aortic dissection. The most important is the ECG or EKG. ECG can show if the heart is beating too fast or too slow. It can also show if you have or having a heart attack. And chest X-ray is very important. It can reveal your lung problems such as pneumonia or collapsed lungs.
Very good.
Okay, the follow-up tests are very important.
So before we play the next follow-up test, let's Jeremy's got a quick little other video that he wants to play, and let's have that. And Dr. Maha, we can come to the other bit after that.
Rich blood to function. The coronary arteries, which are wrapped around the heart, fill that need. In some conditions, fat can build up along the walls of the coronary arteries, reducing the supply of oxygen to the heart muscle. This buildup is called atherosclerosis. The three major risk factors of atherosclerosis are high blood pressure, high cholesterol, and smoking. This plaque can tear, causing the body's emergency repair system to rally. Blood components called platelets stick to the fat that is now exposed by the tear, forming a clot. The clot can completely block the blood supply downstream to the heart. Within a few minutes, muscle cells in the heart begin to die. This is a heart attack. The heart keeps beating but starts to lose its normal rhythm. If a larger part of the heart is affected, it can stop beating entirely. This is called cardiac arrest. Despite common misconceptions, a guy grabbing his chest and falling to the ground is not the typical presentation of a heart attack. Some people do experience the classic Hollywood heart attack, But the truth is, the symptoms of a heart attack can be much more subtle. Many heart attacks begin with only mild discomfort in the chest that intensifies over time. Other symptoms include pain in one or both arms, the neck, or the abdomen. Shortness of breath may accompany the pain, along with unexplained sweating. Time is critical in treating a heart attack. The condition can be totally reversible if diagnosed and treated early. Irreversible damage begins within 30 minutes of blockage, and half of deaths occur in the first 4 hours after symptoms begin. Doctors can perform an angioplasty to reopen the artery. Please watch my next video to learn more about this procedure.
So that's really brilliant, and I think it actually goes to what Dr. Maha is going to tell us next. Is the blood that is going to your heart is critical. So if it gets blocked by the cholesterol, by the plaque, by whatever phenomena, it tightens. We got to open it. And how quickly it closes dictates how bad the event is going to be. So when Dr. Maha is going to discuss the next bit, she's actually talking about, we want to know how much damage has been done and how we can open the vessel up. Whether we put the common stent, that's what this was showing, right? You could put a stent inside to open it, but you got to remember, the coronary vessels are very teeny weeny. They're very, very small. They're not like as you see the big blood vessels in your hands. No. They're actually very, very small. So if you block that pathway, especially one of them is called the LAD, left anterior descending vessel. If that is blocked, you have a major problem. That's the one. The one that we worry about a lot is called LAD vessel. It's one of the most critical blood vessel of the heart. We've got to make sure that is open. You can have blockage in the other areas, but the left anterior descending is, so of all the vessels we have, anastomosis and everything, that's the one that we want to keep an eye on, all right? So go on, Dr. Maha, why don't we pick up a little bit and just briefly tell them about what are the tests and what we should do next.
Okay, the follow-up tests, they are very important. Like coronary catheterization, if this test can help your provider to see blockage in the heart arteries, and the most important is the stress test. These tests often involve walking on a treadmill or riding a stationary bike while heart rhythm is watched. Exercise tests help show how the heart reacts to your exercise. If you can't exercise, you might be given a medicine that affect the heart like exercise does. So the next is echo. Echocardiogram may be done to get better picture of your heart. And the CT scan, it's the different type of scan that can be used to check the heart arteries for the blockage.
Very good. Okay.
So the most important is your lifestyle changes.
Oh, that's one of the most important slide you have. That's one of, okay.
Yes.
Walk us through this. What would you do? What's a healthy lifestyle? We get confused at times. Mm-hmm.
So it's helped to prevent some of the chest pain, like you should choose fruits and vegetables over unhealthy fatty foods.
Mm-hmm.
We should eat healthy healthy foods. We should eat healthy diet, maintain healthy weight, regular exercise, manage your stress, avoid consuming foods that may lead to heartburn, such as spicy and fatty foods and acidic foods. Most important is that we should visit to a doctor on the regular basis for the health screening.
Oh, that's a very good point. And I can tell you, in a lot of places, a lot of countries, this is not a trend. Going to a doctor for a checkup. This doesn't happen. And it's an issue. We wait. All of us do. Even doctors do, nurses, all of them. So going to them matters. Very good point, Dr. Maha. That was really brilliant. Okay. Okay, next.
Okay, now the medicine used to treat some of the most important causes of the chest pain include atrial relaxers, the nitroglycerins usually taken as a tablet under the tongue, and the aspirin, clot busting drugs. These work to dissolve the clot.
Yeah. Okay, next. Very good.
Then,
So aspirin is very important for those taking it. Artery relaxers are important when you're having a heart attack. Those are important. And sometimes you have to use the clot busters who to open up a vessel. And then I am sure there is the next one which has opening it. If it doesn't still open, then you have to go in with a catheter or balloon, open it, or try to do surgery. If it's not repairable, you have to do surgical procedures. So, yes, ma'am. Please, doctor.
yes, then the procedure or the surgeries are very important. If a condition is severe, then percutaneous coronary intervention is help to open arteries that have blocked or narrowed.
Mm-hmm.
Heart bypass surgery, and sometimes if your condition is related to pericarditis or pleurisy, then the doctors have to remove the accumulation of fluid. Then catheter assisted removal of a blood clot in the lungs. If the patient condition is related to gallstone, then we have to remove the gallbladder.
Very good. Okay.
So thank you so much.
That's really brilliant. Very, very good. Excellent presentation. Thank you, Dr. Maha. I think that
Thank
was
you, sir.
yeah, that was very nice, and you've walked us through touching the important aspects of it, and I'm sure all of us in some way have benefited from your presentation. We appreciate that. I think we're gonna conclude and sort of I'm gonna look at if there's any questions. If not, then we're gonna have a look at some of the little parts. I think for last week's, I want to congratulate Dr. Mehek. Yeah, Dr. Mehek Ali for her best response. Dr. Mehek, thank you very much. It was brilliant what you wrote. So well done. Well done. And then the question for next week is up, and it is: when faced with chest pain, how do you differentiate it from being cardiac versus not cardiac? And now that you know a little bit about it, what will you do next? What will you do in that sort of circumstance? Okay, so that's the question, Doctor. What would you do different from what you were doing before? And it's sort of like, and while you're waiting for an ambulance, what you should be doing. Then we just sort of touched on this as well, but how is this talk going to help you change your approach, etc. Okay, so that's that. And then Jeremy has another little, next week is we have a very interesting talk, and this is going to come from Dr. Robert Pearl, and he's going to be talking. He's going to talk about his book that he's recently published. It's about ChatGPT. It's called "How ChatGPT is going to change or is changing the healthcare system specifically." So he'll be here in the second part, and Jeremy is going to be taking up the first part of the presentation, and he's going to be talking about ChatGPT in general and what has been the impact of ChatGPT on it. So it's a very, very interesting topic, and I think you all gonna have benefit from it, because it's unbelievable what's going on right now with ChatGPT. ChatGPT is everywhere. Not ChatGPT, just AI. I want to use the word. ChatGPT is a part of artificial intelligence, and it's getting into our cars, our homes, in Netflix, in movies, in theaters, in you going seeing patients is already infiltrated a lot of places. So, and you're going to see even a bigger, broader impact on ChatGPT. So that's the other little presentation. I think that's going to be coming up. Interesting topic. But Jeremy is also going to help us navigate that topic, and we'll have Dr. Robert discuss about that as well. With that, I think we're going to conclude. But right at the end, I just want to thank my production team with this. Just want to let you know, there's a lot of people making effort behind the scenes for you guys to see this. And it may seem very easy to do, but it's really not. And they do a lot of research. So thank you for Rida, Zalika, Sabah. There's a lot of team members behind this that is working, and yeah, Maya is reminding me again. Don't forget to like. Don't forget to subscribe, because that matters a lot. And we invite you, have your friends and family come over and discuss. And if there's any questions, just bring them over as well, because that is sort of like we encourage them to come and like it and subscribe it. The encouragement really matters, and that's how we're going to continue doing this. And on that, I'm just going to conclude today's talk. Thank you very much, and hopefully we'll see you next week.